Hi everyone, and welcome back to Breaking Down Nursing. Today on this lovely Monday, let's do an NCLEX pop quiz. So let's walk through a question together. How do we answer NCLEX type questions, especially the Next Gen questions? So here we go. Our question states, the nurse is caring for a 72-year-old male admitted to the intensive care unit with worsening shortness of breath and confusion. He has a history of COPD and type 2 diabetes. The 7 a.m. nurse's notes state the following. Client arrived from the emergency department with severe dyspnea and productive cough. Accessory muscle use noted. Diminished breath sounds in lower right lobe with coarse crackles bilaterally. S1 and S2 auscultated. Abdomen soft, positive bowel sounds ×4. Capillary refill 4 seconds. Skin dry and intact. Vital signs. Temperature 100.8 or 38.2 degrees Celsius. Heart rate of 124 beats per minute. Respiratory rate of 32 breaths per minute. Blood pressure of 165 over 64 millimeters of mercury. And SpO2 85% on a 100% non-rebreather mask. The client is restless and oriented to person only. And then you can see the following lab results. pH of 7.25, PaO2 of 78, PaCO2 of 55, bicarb 24, white blood cell count 28,000, lactate 4.2, and blood cultures gram-negative rods. So our question is, which 4 findings require the most immediate intervention? Select all that apply. So first thing when answering NCLEX questions, especially a very long scenario type question, is to read the question first and get an idea of what you're looking for. In this case, we're looking for 4 findings that require immediate intervention. Case in point, priorities. So in going back through the scenario above, the next step is to underline the key things of value throughout the questions, like 72-year-old male, shortness of breath, severe dyspnea, accessory muscle, coarse crackles, cap refill 4 seconds. And then, of course, to label your vital signs and labs, whether or not they're high or low. We have an elevated temp and heart rate and respiratory rate and a low SpO2. We have a low pH and a high CO2, a high white count, and a high lactate. And then, of course, positive blood cultures. Be careful when looking at labs. Always look to see which side's the results and which side's the reference range. A lot of students I've worked with over the years have gotten these mixed up. And so it's something to always look at the top to see, are you looking at the result column or the reference range column first? After we pull out the key details with help of underlining, you can really see a better clinical picture. This patient has a number of respiratory issues, and all of this is pointing towards septic pneumonia. Okay, so let's go back and let's answer the question, since now we have a better idea and we got rid of all the fluff of the question and pulled out the immediate findings that need to be fixed. So remember, in previous videos, we talked about our ABCs and how to go through systematically and choose what's the most important priority. If you haven't watched it, check it out on my channel. So let's go back to the question. Looking at the scenario, do we have an airway problem? No. We also don't have an airway type answer. So we can check airway off and we move to breathing. But remember, breathing is oxygenation and ventilation. Both have to work effectively to have effective breathing. So we can start with oxygenation. Do we have any issues in the oxygenation category? Well, our SpO2 of 85% on 100% non-rebreather is absolutely an issue. And so that would be our first important finding that we would need to intervene on. I don't see any other oxygenation-based issues. Check that box and we'll move on to ventilation. Now remember, ventilation is all about our ability to breathe off CO2. There is a number of issues with this patient and ventilation status. For first, we have a pH of 7.25. The pH of 7.25 is way too low, which means that we're retaining CO2. And also our PaCO2 is 55 millimeters of mercury, which is also too high. Both of those would be significant clinical findings that we would need to address next. And then last but not least, a respiratory rate of 32 is far too high as well, because remember, our normal rate is 12 to 20 breaths per minute for an adult. So the respiratory rate of 32 is high as well. And yes, we can all agree that all of these are issues that all need to be taken care of at some point. The white blood cell count being too high, the lactate being too elevated, the temperature being too high. But the top 4 priorities that need to be taken care of first fall in the categories of oxygenation and ventilation. And that checks the box for our 4 top findings that need immediate intervention, which would all be correct answers. I know that sometimes we choose blood pressure as our answer as it falls into the hypertensive category, but remember, blood pressure falls in circulation. And if we have problems in our airway or breathing categories, we have to fix those before circulation, as long as it's not a massive hemorrhage or an arterial bleed. Even if the blood pressure was elevated, we still have problems that would come before for that. So always keep in mind when it comes to NCLEX type priority questions, ABCs and ABCs in order. All right, everyone. Thanks for watching. Have a wonderful Monday and take care. Until next time.